Let's talk about intravenous iron. Intravenous iron is a way of rapidly getting iron into your bloodstream with a tiny tube that's placed in a vein in your arm. Now, you may think that just because we're giving it to you intravenously, this formulation is more dangerous than oral iron. That is actually not true. Intravenous iron is extremely safe, and it is an efficient way to increase your iron stores. It's like filling that bathtub by opening the tap instead of drop by drop with the oral iron. Patients feel better faster. They overall have a better quality of life after taking IV iron. And in fact, intravenous iron has less side effects compared to the oral formulations. There are several reasons why intravenous iron may be prescribed for you. First of all, if you're not absorbing or tolerating the oral iron. Second of all, some patients have severe iron deficiency where your blood levels are actually even low because of low iron, and we need to correct that iron deficiency quickly. Third, if we need to correct your iron stores quickly, for example, if you have upcoming surgery, intravenous iron is the way to go. And last, for some patients who are pregnant and close to delivery, they may choose intravenous iron. Let me tell you a little about the process of getting IV iron. First, your doctor will give you a prescription. Usually, it will be for one of two formulations, Venofer or monoferric. Now, you will need to go to the pharmacy to pick the medication up. You will need to pay for your IV iron. However, many insurance providers subsidize or cover this cost, but that will depend on your individual plan. Now, if you live in Ontario and you qualify for the Trillium Drug Plan, both these formulations of IV iron are covered, so speak to your pharmacy and speak to your doctor about that. Remember, cost should not be a barrier for you getting IV iron. The next thing is that you will need an appointment at either a hospital infusion clinic or an outside infusion clinic for the IV iron to be administered. No preparation is required, simply bring your IV iron to the infusion clinic. The nurse will start an IV and intravenous, and the process will take about 1 to 2 hours. Side effects can start 1 to 2 days after the infusion, and most side effects are really mild and do not require any treatment whatsoever, and they resolve on their own. Now, serious allergic reactions are extremely rare. Some of the common side effects include headaches, muscle or joint pains, patients feel achy. Some patients experience nausea, or some will describe a metallic taste in their mouth. After your IV iron infusion, you will be able to drive home and resume all normal activities. In conclusion, remember that iron is extremely important, and iron deficiency can cause serious health issues, and it is important to treat it so that you feel better. Now, if you're going for surgery, correcting iron deficiency before surgery is important because it helps to decrease complications and helps with your healing.